If you're in your 50s or 60s or even 70s and you're thinking about hormone replacement therapy and you're wondering, am I too old? Did I miss the window? Is it possible I can use hormone replacement therapy? Then this video is for you. I'm Dr. Jen, double boarded OBGYN in integrative medicine. I help women in perimenopause and menopause every single day gain clarity and confidence without judgment. And I want to talk about hormone replacement therapy in your 50s, 60s, 70s, and beyond. And what do we know about it? Is it safe? Should you use it? How do you talk to your doctor about it? And really, what is the information around HRT? So first of all, your fear is valid. So there's been lots of misinformation over the last 20 years, ever since this pivotal study called the Women's Health Initiative. The Women's Health Initiative was released in the early 2000s. And at the time, it basically said hormone replacement therapy will cause breast cancer, blood clots, strokes, heart attacks. And at the time, it scared both patients and physicians. The prescription rate drastically went down. In fact, right now, around 5 to 8% of women actually get hormone replacement therapy when they go to their doctor. And that misinformation that has happened over the last 20 years has fueled so much fear in patients. In fact, there are women who were actually on hormone replacement that were taken off even though they didn't want to be taken off because their physician was too scared to actually prescribe it. And over the 20 years, we've learned so much about who should be on HRT, when to start it, and what is the right option for you. So let's dive into that in particular. So first of all, I want to say at the time when the Women's Health Initiative study was released, the average age of the woman in that study was actually in her 60s. So the Women's Health Initiative study, if you're not aware, it watched women, there was over 12,000 women in the study, and it was looking at women who were started on hormone replacement therapy. What is their risk of breast cancer? What is their risk of DVT and stroke? Actually, it looked at a lot of things. It even looked at colon cancer and multiple other bone fractures, hip fractures. Like, it was actually had a lot of pivotal outcomes that was studied. Where did this too late idea come from? So in the Women's Health Initiative study, they had this timing hypothesis. It essentially said that if you were over the age of 60 or outside of 10 years of when you started menopause, because remember the average age of menopause is 51, then your risk for heart disease, stroke, and any heart disease essentially went up. And this was based upon this study because most of the women in this study were actually older. They were getting started on HRT in their 60s or 70s or even late 50s. And so this risk of cardiovascular disease was noted to be higher in this population. So this timing hypothesis happened that stated basically that you should only prescribe hormone replacement therapy as long as they're within that 10-year window. But over the years, modern medicine, we have now gone back on this study and looked at the data a little bit more with fine tune, right? With different parameters, and realized there are several things we learned from that study. First of all, yes, timing does matter. The risks of someone, say, who is 49 is very different than someone who is already 60 because estrogen actually causes your blood vessels to be pliable and flexible. And so as you go through menopause and you're on the other side, your vessels become stiffer, less elastic, less pliable. Everything actually, even skin, right, becomes more elastic and pliable when you're younger, but stiffer when you get older. And so because of this, adding artificial estrogen can cause increased risk of heart disease. So the idea is the best time to start hormone replacement therapy is within that 10-year window when things are still changing and you can prevent the stiffness. This is why you see women who develop high blood pressure when they get into menopause and they say, what happened? I was completely healthy and now I have hypertension. And that's because you lose that estradiol effect on the blood vessels. So the timing hypothesis is correct in that it is safest and best to do HRT within that 10-year window. But it does not mean that women can't have it. Let me say that again. It does not mean you can't say no or that you're going to say no to someone who is outside of the window. What you have to understand is how safe could hormone therapy be for this patient? So what are their cardiovascular risks? So when I see a patient who is outside of that 10-year window, I assess, well, first of all, what is their lipid profile? Do they have hypertension? Do they have inflammation by looking at a CRP level? I often get a coronary artery calcium score because I want to know do they have plaque formation in their coronary vessels. And then I look at their other comorbidities. For someone who's healthy and, exercising, nutrition, has 0 CAC score, has normal triglycerides and good inflammation, there's no reason they can't start hormone replacement therapy. Now, obviously, you need to talk to your doctor specifically about you, your medications, your medical history, but in general, it's not a contraindication to say you can't start HRT. Now, what kind of hormone replacement therapy would you start? Well, I generally tend to avoid the oral options because, again, I had mentioned in other videos that oral estrogen is associated with higher cardiovascular risk because of the metabolites of estrogen. So I tend to use transdermal. So that would be patch, that would be cream, that would be mist. I tend to use a transdermal route in someone who is past that 10-year window. And I do tend to use progesterone because I think estrogen and progesterone work nicely together, even if they don't have a uterus. That's just my typical protocol anyway. So when I'm talking to a patient about should they use HRT, we often have a conversation about their risks. What are the benefits of hormone replacement therapy? Because there are still benefits even if you're out of that 10-year window, to bone, to brain, to your sex life, to many things. And so there are reasons people might choose to still start hormone replacement therapy out of that window. Now, this whole time I've been talking about systemic hormone replacement therapy, not local. Remember, vaginal estrogen or vaginal DHEA, local hormone replacement therapy is a whole different category. This has very, very minimal risks, and women who are over 60 can completely use vaginal preparations without the same risks. So there's no reason that your doctor, if you go to them and say, I'm having vaginal dryness, I'm having urgency, I'm having recurrent UTIs, there's no reason you can't start vaginal estrogen. It's pretty much safe for almost everybody. So you need to talk to them about getting a prescription specifically about you, but it's important to know that systemic estrogen is very different than local estrogen. So in summary, basically, if you're outside of that HRT window of 10 years, over the age of 60, it doesn't mean you can't take hormone replacement therapy. You need to see a menopause specialist who understands how to evaluate your risk, to have a good informed consent conversation with you, and to look at things like transdermal estrogens and progesterone, and even testosterone that may help with not only symptom relief if you're still having them, but also longevity. So I hope this answers the question. If you have questions specifically about that, please let me know in the comments. Please like and subscribe this channel and share it with your friends.